This is my audience. Hello, my name is Noah Lucart, and my topic today is stroke education. And the specific purpose for my speech is to inform my audience about the different types of strokes, how to avoid a stroke, how to assess for a stroke, and what to expect if a stroke occurs. So how many of us know exactly what a stroke is? It's a very loosely used term. I'm sure everybody's heard of it at some point, whether it be a family member or just a friend. But how many of us know how to avoid a stroke or to identify if a stroke is happening and what to do? So to be prepared for this case scenario, I'll cover the basics about what the types of strokes, risk factors, signs of a stroke, and possible interventions. So to understand the well-known phrase of a stroke, you must start with the very basics. So the first one is that there's two categories of a stroke. There's ischemic and hemorrhagic. Ischemic is a clot in the brain that's disrupting blood flow to the tissues. And then there's a hemorrhagic stroke, and that is an intracerebral hemorrhage, which is a bleed inside the brain, and a subarachnoid hemorrhage, which is a bleed between the inner and outer layers of tissue covering the brain. So now that we have a little bit of knowledge of what a stroke is, we can learn how to decrease the chances for one. So we want to attempt to live as healthy of a lifestyle as possible. The main risk factor is high blood pressure. You want to get that checked out by a doctor. If you do have high blood pressure, manage it and take your blood pressure once daily. High cholesterol, you want to eat a balanced diet, avoid excess of red meat. Type 2 diabetes, you want to manage your blood glucose and have a healthy diet and exercise regularly. If you have AFib or aflutter, that's a condition of your heart just beating really fast, and it can increase your chance of having a clot, and then that clot can leave your heart, go to places like your brain. Heart failure, smoking, you want to avoid all forms of tobacco, and drugs and alcohol, avoid all forms of that as well. So with our healthy lifestyle in place, let's learn what to do if we think a stroke is occurring. So a well-known acronym is the FAST acronym, starting with F, that is facial drooping. Ask whoever to smile real big if one side of their face is drooping and the other one's not, that's a sign. Ask them to puff their cheeks out or raise their eyebrows if one's drooping, that's a sign of a stroke. A, for arm weakness, ask whoever to raise both arms up. If one of them drifts down, that's a sign of a stroke. You can touch both sides of their arms for sensation, just to see if it's intact. If you can feel one side, not the other, that's a sign of a stroke. S, speech difficulty. Carry on a normal conversation with whoever. If their speech is slurred, or they have trouble getting words out, or having trouble to understand what you're saying, those are all signs of a stroke. So T, time is critical. If any of these that I just talked about is happening, it is time to call 911. Time is brain in this situation. So now that we know when somebody might be having a stroke, now you may be thinking, well, what now? You call 911, they're at the hospital. So possible interventions for a stroke, it depends on what kind of stroke. If it's ischemic, you have a clot in your brain. If it's less than 4.5 hours from the onset of symptoms, we can do something that's called TPA or TNK. That's just the fancy way to say it's medicine. That is a super aggressive clot busting medicine. It's injected into your veins and it busts up any clot in your entire body. So the goal for this is to bust up the clot in your brain and have the blood reperfuse back to the tissues. Another intervention is a mechanical thrombectomy. If you have a clot in your brain, they can make a small incision into your groin, feed a catheter through your artery all the way up to your brain, and basically grab that clot, pull it out, and the same thing as the medicine before, we're hoping for reperfusion back to the brain. So if you have a hemorrhagic stroke, a bleed in your brain, we keep a super tight control on your blood pressure. We don't want it to be too high, we don't want it to be too low. If it's too low, there's no perfusion to the brain. If it's too high, you can still have excess amount of blood collecting in your brain. If you have too much, then it can swell and it has nowhere to go. So what we can do for that is take a piece of your skull off and allow your brain to swell out, and then give it time to decompress and swell back to its normal size. So if you have a bleed in between the inner and outer tissues of your brain, we can put in what's called an EVD, an external ventricular drain, and it's a catheter into your brain that takes off extra spinal fluid and blood in your brain to prevent some swelling. So with those interventions in mind, we now have all of the basic information on strokes. So with everything that we just talked about, I hope you have a better understanding of what a stroke is, the risk factors for a stroke, how to identify if one's occurring, and what to expect if a stroke happens. And I thank you all for listening.